Hello Paula, today I'm going to discuss the diagnostic test video presentations, which is the barium enema and barium swallow. Actually, I have a small pamphlet here, which is a black and white. So first I would like to discuss with you what is the barium enema and the barium swallow. Barium enema involves filling the large intestine with diluted barium liquid while being X-rays images are being taken. So, while barium swallow, it is an upper GI series, is an examination of the esophagus and the stomach using the barium to coat the walls, the upper digestive tract, so that it may examine under the X-ray. So, what is the purpose of this exam? A barium enema, the test diagnoses disorder of the large intestine and rectum, such as includes abdominal pain, blood in stool, ulcerative, and colitis. While in barium swallow, the test used to identify any abnormalities such as ulcers, tumors, hernias, and swallowing difficulties. Yeah. So how's that test done? When booking both barium enema and barium swallow, whether for an inpatient or outpatient, you must book the barium first. Otherwise, the barium from swallow will interfere with accuracy, and the client must be instructed to remain nothing by mouth for 8 hours prior to the test and will be placed on the restricted diet for 2 or 3 days. So, how long does test take? A barium enema typically takes between 30 to 60 minutes, and it's performed at hospital or a specialized testing facility, while the barium swallow procedures may take 30 minutes to finish. In a certain case, it may take up to 60 minutes to fill the stomach. So, is there any medications involved? In barium enema, usually they ask the patients to take laxative the night before the exam. A laxative will help empty your colon, or both barium enema and swallow should ask your doctor about any medications concerned. She or he may stop taking them the days or hours before the examinations. So what are the preparation for this test? In barium enema, your doctor will advise you to cleanse your bowels the night before your test. This may include the using laxative or taking an enema at home. You may be asked not to eat or not to drink any clear liquids such as water, tea, or coffee without milk or cream and broth. So, while in barium swallow preparations for CAT scan, clients are advising avoiding food on the day before the examinations. He may be asked to eat a low fiber diet for 2 or 3 days before barium swallow test. You will ask not to eat or smoke after midnight before the examinations. Is there any risk of these examinations? In barium enema, exam possess few risks. Rarely, the complications of barium enema, such as inflammation in tissues surrounding the colon, obstruction in GI, gastrointestinal tract, tear in colon wall, and allergic reactions. So, while in barium swallow is generally safe test, but likely any procedures are occasionally complications, such as allergies reactions, may occur in people who are allergic to the barium drink and constipations. So, is there any client's instructions after care? The clients or patients should be able to go home when the test is done. Some cases, you may have some stomach cramps due to trapped air, so you may want to stay near at the toilet for an hour. Same as barium swallow, you can back your normal diet unless you advise otherwise with the doctor. Because the barium is white, your stool will be chalky and light colored for 1 to 3 days. Okay, so what are the diagnostic imaging department would you need to contact in order to book these assigned procedures? As a unit clerk, it is our duty to contact the MRI or CAT scan department in order to book the client's appointment or examination procedures. Is there any additional task to be completed by the assigned procedure? The unit clerk will be responsible to fill up all the information of the clients and send it through fax to the Diagnostic Imaging Request Department. So what are other departments will the hospital unit clerk need to be contacted? As I said, aside from MRI, CAT scan, the hospital unit clerk also needs to be contacted with the laboratory department to follow up the results of the clients. So I guess the conclusion here is the report concluding as a hospital unit clerk to give all the right information to our clients prior before their schedules of their diagnostic imaging tests. Explain with them the complete detail, the right procedures, the day before the day of the examinations. And Paula, and for all the complete information of this brochure or pamphlet, please see the attached brochure at the D2L. Thanks, Paula, and have a wonderful day.